I'm Tracy Foster with Maryville University, and this is Chica. She's volunteered to be my patient for this neurological exam, and she's over the age of 18. In this neurological exam, we're going to do some inspections, some palpation, and some neurological testing. Prior to the examination, I checked, and Chica is alert and oriented to person, place, and time. I also watched her as she was walking, and her posture and her gait with the stride, and everything was normal. So we're going to start with the assessment. We're going to start with the 12 cranial nerves. And with that, cranial nerve number 1, which is the olfactory, is the sense of smell. And I'm going to have Chica smell some smells while she's closing one side of her nostril.
Coffee. Peppermint.
Okay, very good. And that's a normal finding. Cranial nerve number 2 is the optic, which is the visual acuity and visual fields. And prior to this, I had her do the Snellen chart, and she was 20/20 in vision in both eyes. And we'll have you stand up, and we're going to do your visual fields, okay? So I'm going to have you cover this eye, and let me know when you see something come into your visual field.
Now. Now. Now.
Okay. Cover the other eye, same thing.
Now. Now. Now.
Very good. And I'm going to have you stand up here because we're going to actually go on into the cranial nerve number 3, which is the ocular motor, the cranial nerve number 4, which is the trochlear, and the cranial nerve number 6, which is the abductus. And with these 3 working together, we're actually going to look at your 6 cardinal fields of gaze, okay? So I'm going to have you follow my finger just with your eyes. Very good. And what I was doing also is watching as her eyes close to make sure there's no eye drooping, and there's not any drooping. And then next what I'm going to do is check your pupils to see for reaction to light, okay? Okay. And both of her pupils are round, reactive, and equal to light and accommodation. Thank you. Next we're going to proceed on to cranial nerve number 5, which is the trigeminal. And with this trigeminal, we're actually going to inspect first. And I'm going to look to make sure that there's not any muscle atrophy here, and there's not. Make sure there's no jaw deviation. Make sure there's no tremors noted, and there's not. Next, we're going to palpate. I'm going to have her clench her jaws. Okay. Is there any pain with that? Okay. No pain with that. And I'm also going to check her sensation for touch.
Soft. Soft.
Okay. Very good. Next, we're going to move into, actually with that too, we're going to check her corneal reflex in this nerve and make sure that she has a blink reflex, which is their corneal nerve reflex, and she does, and that would be blinking whenever there's any object coming toward her eye. Okay, and next we're going to go on and move to the facial cranial nerve, which is number 7, and I'm going to have her do some facial expressions. I'm going to have you smile, do pursed lips, raise your eyebrows, close your eyes. And what I'm doing here is looking to see if it's symmetrical. Everything is symmetrical, and it is. Okay, and that's good. This cranial nerve also does some taste, which is on the lateral side of the tongue. Okay. Then we're going to move on to cranial nerve number 8, which is the acoustic, and this is her sense of hearing. And we're going to check lateralization, and we're also going to check air and bone conduction. With lateralization, I'm going to put this in the middle of your head and tell me if you hear it equally in both ears or not, okay?
Equal.
Equal? Okay. Now I'm going to do it again, and I'm going to actually put it to your mastoid bone and let me know when the vibration stops. I'm going to move it to the front of your ear, and you let me know again when it stops, okay? And we're going to time it.
Okay. Now. Now.
Okay. So air conduction is normally 2 times what bone conduction is, and Chica's was normal. That's a normal finding.
Thank you.
Okay. So we're going to move on to cranial nerves number 9, which is glossopharyngeal. And what we're going to do is, with the glossopharyngeal, this is actually a taste sensation on the posterior third of your tongue, which is usually a bitter taste. And cranial nerve number 10, which kind of works in conjunction, is the vagus nerve. And we're going to inspect the palate and the gag reflex and also the swallowing. Okay, say ah.
Ah.
Okay. We're looking at this, swallow for me, and we see everything is swallowing just fine, and the ability to swallow. Okay. Next, what we're going to do is we're going to move on to cranial nerve number 11, which is the spinal accessory. And this is the trapezius and the sternocleidomastoid. So I'm going to push on her shoulders as she shrugs. Okay, and then I'll have you turn your head left and turn your head right. Don't see any issues with or any pain with that. Okay, so that's checking the cranial nerve number 11. Cranial nerve number 12 is called the hypoglossal. And this is where we're going to check her tongue. We're going to have you stick your tongue out, side to side, up and down, and then push against your cheek. Okay, push against your cheek. Okay, and there's no abnormals there. Also, it's a speaking and some sounds like an L,
L,
T,
T,
D,
D,
N.
N.
Okay, thank you. And that concludes the assessment of the 12 cranial nerves. And we're going to move on to the cerebellar function and the proprioception. And first what we're going to do is we're going to evaluate her coordination and her fine motor skills. I'm going to have her tap her knees with her hands, okay? Then I'm going to have you do your from your front to your palm, back and forth, okay? And that seems to be normal. Also, I'm going to have you do your heel to your shin on this foot, and then heel to shin on the other foot. Okay, very good. These are normal findings as well. Next, I'm going to have you stand, okay, and I'm going to have you close your eyes. I'll stand beside you. Close your feet together and your hands at your side. We're checking her balance and her equilibrium. It's called the Romberg test, okay? And a little bit, if she was to, you can open your eyes now. If she did a little bit of swaying, that would be normal, but you won't want her to sway very much. Then we'll have her check her gait some more and do some heel to toe for me so I can check the sequence in her stride and her arm movements. Okay, turn around. Same thing. Okay. Thank you very much. Now you can come up here and sit down. And all that was normal as well. Then we're going to move on to what's called the sensory function. And with the sensory function, we're going to start with a series of tests. And the first one's called the primary sensory responses. And this is going to be to sharp and dull objects. I'm going to have you close your eyes. And I want you to tell me if this is sharp or dull.
Sharp. Dull.
Okay, very good. Next test we're going to do is called the vibratory responses. And this is going to be with your eyes closed again, but I want you to close your eyes, and I'm going to put this over a bony prominence. I want you to tell me when you feel the vibration and when it stops, okay?
No. No.
Okay. I'm also going to check the lower extremities, the same thing. Okay, close your eyes.
No.
Okay.
No.
Very good. Thank you. Okay, next what we're going to do is what's called familiar objects. And we'll put a familiar object. I want you to close your eyes for me. Okay. Tell me what object you feel in your hand.
Paper clip
Uh-huh. Other side. Keep your eyes closed.
feels like a key.
Yeah, very good. Very good. And that's what's called the familiar object test, and she had normal findings on that. Now we're going to do what's called a perception of position. Okay. So I'm going to take her thumbs. I want you to close your eyes and tell me what I'm doing with your thumbs.
Up. Down.
Okay. Open your eyes.
Up. Down.
Okay, that was a normal finding again on that one. Next we're going to do what's called a 2-point discrimination. And I'm going to have you close your eyes. And I want you to tell me how many points you feel, if it's going to be 1 point or 2 point.
I feel 2.
2. Okay, let me try this hand.
2.
Okay. That was a normal finding as well. Now I'm going to actually have you close your eyes, and I'm going to draw something in your hand, and I want you to tell me what you think I draw here.
8.
And this one?
Feels like a T.
Yep, exactly. Now I'm going to have you keep your eyes closed, and I'm going to touch a part of your body, and I want you to tell me where you think I'm touching, okay? Close your eyes.
Left ear. Right neck.
Very good. And that concludes the sensory function examination. Next, we're going to move on to the superficial and deep tendon reflexes. We're going to start with the abdominal reflex. I'm going to have you lay down. We would want them to lay down in this examination, and we would start and do a stroke between the pubic area up toward the umbilicus, and we would see a contraction, and that's a normal finding. Thank you, Chica. Next, if it was a male, we would actually do what's called the cremasteric reflex, which we would stroke the inner thigh area, and if on the side that we stroke, there would actually be a rise in the male genitalia. And of course, this chick is a female, so we wouldn't be doing that. Next, we're going to move to the plantar reflex. Okay, so what we do on the plantar reflex is we would take the foot and we would start lateral and make a C, and there's flexion here. If there had been extension, we would consider that an abnormal response, which would be called the Babinski's. Okay. Next, what we're going to do is we're going to do our deep tendon reflexes. Okay, so I'm going to go over here and we're going to start with our biceps. Okay, and then we're going to do the brachioradialis. Okay, and that was a positive. Triceps. Okay, and these are all +2 because they're normal responses. Then we're going to go down and find the patella, and we're going to go down and we're going to do the patella. Okay, and then we're going to do the Achilles. Okay. And then next what we're going to do is if we had any hyperreflection after these reflexes, then we would actually do a test called the ankle clonus, and we would support it, and we would actually do dorsiflexion, okay? And there should be flexion there, the dorsiflexion. There shouldn't be any tightness or anything there. That's a normal response. So this concludes our neurological examination.
Thank you.